Today's class, we will see about the forensic nursing officers or forensic nurses duty. What is the difference between the nursing duty and the forensic nursing duty? Same, she has the knowledge of a scientific knowledge of nursing, also the scientific knowledge of the forensic science and forensic medicine. That's what the forensic nursing. So she also will be take care of the normal patient. But when the normal nurse will take care of all the kind of cases like medical cases, surgical, orthopedic, other things. But when this forensic nurses, mainly she has to focus on victim as well as the accused. How these victims are coming, where it is happening. So where she can work, these and all. Today's class we will see. So where is the area of the interest? What she is going to collect? How does she differ from the data collections? So what data usually she mainly collect? Data collection and history collection is an important aspect in nursing and the medical field. Let us see. First, forensic nursing data collection. The forensic nursing data collection method, either the subjective or objective like the other thing, where data collection differ from the nursing, how it does differ. She is always collecting the data from the place of incident where it is occurred, and sometimes she has to collect the data for mainly from the police station. If it is if the patient is accused or the victim is admitted in an emergency department, she has to collect the data from the emergency department. So the data in the sense she has to collect, and also she has to take the data mainly. What she sees that objective is like some assault had happened, sexual assault, some harassment had happened, or suicide they are trying to attempt. So the main data which we are focusing upon the specimen collection. So what is called the specimen? The specimen collection is also done by the ordinary nurse. She also usually what specimen she will be collecting? Mostly she will collect the blood and sputum and feces or something, or sometimes lab technician will be coming and collecting. Here in forensic nursing, she plays a vital role in collecting the specimen. The forensic nursing principles and protocols are clearly telling that is the how much amount of the specimen need to be collected, and what is the temperature she has to maintain, what all the labels are there, who and all has to sign it, and what all the preservatives has to be added. Let us see. The first one, the sources, mainly semen, seminal fluid, saliva, tissue, cells, teeth, etc. Also nail, hair, and then torn pieces of clothes, and sometimes wet clothes, wets or the air dryer cloths, and vaginal swab. The vaginal swab, mostly 80% of the crime like a rape crime, other things are happening. So while you are taking a vaginal swab, she has to maintain first swab from the labia majora, second labia minora, then vaginal, then cervical, and then anal and the rectal swab also it is necessary for her to take it. Then preservatives. Preservatives why we are adding? To make it is to avoid the sample, to prevent the destruction of its original character. So, it's rectified spirit, 90% alcohol is being used in the all viscera is suspect cases of the cases of. So, this suspected cases of poisoning, they are telling how all the organs has to be taken. If you see the suspected cases of the poisoning, in what kind of a death it is happening. If you take the specimen collected for the poisoning, special protocol they have given. If you are taking from this all the specimens can be collected from the mortuary. The stomach content and the small intestine content, nearly they need 30 centimeter of the stomach itself they need it. Then liver means it's a 500 gram liver needed. Kidney is half of the kidney needed for the investigation. Blood sample 30 ml is needed. DNA test and other analysis. Urine sample 30 ml is needed. And then sodium chloride and the spirit is also needed. Nearly 30 ml you have to present it. Okay, let us see what all the other preservatives has been added. How these preservatives. If you see anticoagulants, blood, mainly blood is done for the DNA test and the DNA analysis. Only blood can be given DNA? No. Even a hair. Hair means if you want to take hair follicle should be there. The DNA will be diagnosed. Then it will be fluoride and potassium oxalate. Thienol and the toluene is for the urine specimen. Sodium fluoride or alcohol. And nail and hair bones doesn't need any preservatives, but in the sealed pack you can have to pack it. Okay. Then the nurse, forensic nurse, has to remember the points has to remember, like how to collect it, what is the amount, what is the source, what is the site, how much amount, the quantity, and also she has to follow the procedure, wearing the gloves, and correctly she has to correct it. Then the storage also is an important point. So what is the storage also? She has to refrigerate it properly. So before putting refrigerator, she has to label it properly. So what kind of the label? The label should possess the reference number and the date and the time and the name of the deceased and the nature of the material, either the what kind of a material which is inside. If does needed, it's a container also, it can be used. Then the nature of preservative, what kind of the preservatives are inside. Sometimes you have to need it to put it in the refrigerator. So in the correct temperature has to be maintained. Then her signature and stamp is very important. Why her data collection and the specimen collections are important? Because this is the nurse not only giving the care to the individual victim or the accused, also in the society she is playing a part of role and bringing the justice to the society. So it's her responsibility is very important. The negligence. You can ask him, then other nurses no need to be follow the law and order, any yes, the other nurses negligence will take away the patient's life. Here the forensic nurse's negligence will be punished very severely, because what she will do it, either she can manipulate or she may forget to keep the sample. For example, RG Kar, what happened? The judges were asking so many questions. So, did you collected the sample under the camera? Is there any recording is there? The camera should be showing what is the date and time. You have to set what time you are recording. Is there any person is supervising? Is there any evidence is there? Did you store in a correct temperature? So, they couldn't find out how many member has been raped that particular victim. So, this is to bring the social justice. If she is not following any of these fraudulence or anything, negligence, intentional or unintentional, either thing, this failure to correct it. So, if she did the mistake, she has been punished under the IPC section 201 Indian Penal Code. What is she is punishing? There's sometimes disappearance of offences by the imprisonment and then by the fine. So what she has to do? What she can do? Maybe failure to preserve the evidence, or failure to note the identification, or failure to collect the not correct amount, or failure to give the first aid to either the victim or accused. She has to give the first aid. So failure to take an informed consent before taking the samples. Why she is taking? Okay, to prevent herself, the forensic nurse, to prevent getting into her under the law and order or the imprisonment, how she has to protect herself. So, she has to act as a vigilant nurse and the accountable nurse. First, she has to provide the first aid to the victim. To behave as a good human being, give a first aid, either the victim or the accused. Take a consent from the victim and note that identification marks of the victim. Then the level of container evidences are correctly. Are you following the protocol? If the blood means what kind of a preservatives you are following, what is the temperature you are maintaining, and then preserve the evidences correctly as per the protocol. So these are all the activities will be prevent herself prevent herself to going to the jail, or to avoid or can correct her behavior. In forensic nursing, her behavior has been watched and the negligence has been punished under the section of IPC 201. Then she has the responsibility above all. Packing should be appropriate, either put in a container or it is needed by the pack. And her signature, seal, stamp and date and time is very important. So, next, in the matter of informed consent. So, informed consent is in a very important role. Either you collect the doing an invasive procedure or non-invasive procedure. We always do the informed consent as nurses, and written consent we are doing for some operation and surgical procedure. Here also same way we have a three kind of informed consent. First one is the implied consent. Implied consent is limited to the four types of the physical examination. What is the fourth type? Auscultation, percussion, right or not, and palpation. So these are all the four important observation. So this one, four important physical examination, it is limited to that. And then express this either the oral, the basic, like for example, basic medical examination like BP checking or blood pressure checking, or you want to do the rice tube feeding or something, you have to inform what are you going to giving to the victim or the accused. And non-invasive procedure like anything else you are checking with the temperature or the pulse oximeter, no need to like just you can tell what's going on, what you are going to checking for. And the written consent, you have to take the major diagnostic procedures. For example, gun shoot, some accused or the victim is coming for someone try to kill with a knife, with the stabbed injury or neck injury or the suicide, they are coming, they have right to do some of the surgical procedure. So you have to take care what is the medical legal cases. So you are police also. So why? Because you are responsible to give the information to the judiciary, police station, relatives and non-governmental agencies and the human rights. So you should never violate the human rights, either the accused or the victim. And the major diagnostic procedure, you have to take a written consent. Even the blood transfusion and the bronchoscopy, you are putting some of the scopies only. Why you have to? It's not a, yes, it's also bronchoscopy also, it's a very common dangerous procedure you have to. Yes, and about the informed consent, what she has to inform. For example, ordinary nurse will inform, good morning sir, today I am going to give you a IM injection. Can I give you? It will be paining. This is the injection for what? Because for the pain, etc. Here the informed consent is, then you have to inform, your responsibility to inform what is the nature of the disease and what is the kind of a treatment, because the accused will be afraid, the victim will be afraid, because you are taking him to the government hospital and accused maybe they think that you all going to, because psychologically he will think that the police maybe encounter me or maybe kill me, I have done something mistake. So that the threat, you have to treat him as a human being. The judiciary will decide and give the punishment, but the nurse has to give a first aid. If she is not giving a first aid, she also will be punished under the IPC section 201 as a, and also she is eligible. Judges can take an action to put as a imprisonment, and also she has to fine the pay and penalty, fine and penalty. So this much this much importance they are giving for the forensic nurse to give the first aid. And then alternative options are there, or what is the cost, if it is that you have to inform. So this is the main role of the forensic nursing roles. So data collection is a very important. Data collections mainly by, where is the place of data collection, we have seen sources, and where how much the amount she has to collect is an important aspect, and how the preservatives, if she is becoming a negligent nurse, then negligence will be will be punished under the IPC section 201. So we have to know how to prevent ourselves and act vigilantly. Accountability is an important. The more all above all, she must be very honest and bold. Nurse is a forensic nurse. Thank you.